And I mean, you're home a week or two or three ago and you're saying, hey, you know what, I need to go to the dentist. What made you do that? Just that it was time or anything in your mouth going on?
It's just,
Well, he went
Okay.
to my dentist.
Okay, that helps.
And she kind of said that I can't help him, you need to go to a specialist.
Okay.
So, and that was a couple years ago. So, I don't know how he doesn't have pain. Like, he'll lose a tooth and he doesn't feel it. And I'm very, like, sensitive, so I'm like, but sometimes his cheeks get really puffy, and that worries me.
Okay. Well, here's what I do, just so you know my whole approach to patients. My whole approach is this. Look, I've done this I just said it to you, for 45 years. And I've done it at a really high level, and it's all I did. When I say it's all I did, I mean, being here today, being a dentist, I train other places to learn myself. I'm going to like Brazil this year to learn some crazy stuff that you're never going to need, by the way, right? And I've taught it for many, many years. And so I don't look at a new patient that comes in here as, I always look and actually am rooting for you to be healthy. Healthy is where we start, right? Healthy gums, healthy teeth, keep you away from emergencies, from things, make you healthy as you can. How old are you?
44.
Yeah, so you should want to be healthy in there. And the thing about dentistry, if you think about it, it's one of the few sciences, like if I'm a dermatologist and you have a big rash on your face, I don't have to convince you that there's a rash on your face. Or if you have a temperature and a fever, it's obvious you need help. But in dentistry, you can have be really jacked up and it doesn't have to hurt. That's the whole thing. So the way I start out is I go through your x-rays, which I'm going to do from right to left. Because dental x-rays are kind of a thing that, can you get me a different chair?
Yes.
One of you guys?
You want it higher up?
Yeah. So you said it's been a while. Is that a year? Is
Yeah,
that
about a year.
Well, more than a year.
Well, over a year.
It's been way more than a year.
is it?
Yeah, I mean, I kept on telling him, but he wasn't being proactive and finding whoever.
Yeah.
So I finally went, and I texted him, I don't know, 2 weeks ago, you have a dentist appointment on this day.
Oh, thank God for you. Yeah.
But like, that's what we do, like, he takes care of me, and actually
That's
I
cool.
was pretty sick for a really long time, so he was concentrating on me, and I think he was neglecting his teeth. So, that concerns me, and I feel kind of guilty about that, so.
Well, I'm happy that you're like that because, listen, one thing I'll tell you about my patient population that comes to me, if you took a big scoop, like ice cream, of my patients out, I bet they're pretty darn healthy compared to another segment of people in the population. Because how healthy you are in dentistry depends on how into it the dentist is. It's just true.
Okay.
You know, if your dentist is walking through the motions and worried about his golf game on Wednesday, I've never golfed, by the way. So, okay, let's go through it because you can actually do this with dental x-rays. You can't do this with MRIs and stuff because patients don't understand. This is your upper right. So when I look at this, I just want you to show you some things that you're not going to know about. But the first thing I see on you, you see this gray stuff? That's your bone. And you've got really good bone, and that is really important. I don't know what your gums look like because I haven't looked at them yet.
Yeah.
But a lot of patients, even your age, come in here, and the bone's not here; it's up here somewhere. It's receded, and you don't have that. All these little things you see are fillings you've had done. So to be honest with you, John, I'm not looking at you in the beginning, except you have a missing tooth on the upper right,
Yeah.
and I'm not like blown away by anything on you yet. Let me go slower. Let me see. Okay, so now we're going to your upper left. Some of these things I have to look in your mouth to be sure is this accurate or not accurate. What you see her doing, like flap it on so it's color. See, that's AI, by the way.
Yeah.
You know, and I don't fall for everything AI says that's wrong with you because I trust me more than AI, but it clues me in to look at things. Like this is your upper left molar. There could be something going on there. I'm not sure. You don't have any pain, correct?
No.
Right? Drop down to his lower left. Okay, So the first thing I see here that I want to, you probably have no idea when that root canal was done, right?
There was no root canal.
Huh?
He's never had a root
I
canal.
had a root canal.
Yes,
When?
he's got two of them. There's
Yeah,
one of them.
It was, I think, before we got married. I mean, it's 20-some years, I think.
What?
Yeah. So look, I want you to see this.
Who didn't?
Police and reoperate.
Well, how long you two been married?
Oh, 24 years?
Okay, you got married young.
Yeah.
Well, guess what? He has a root canal. He has two of them, actually.
I just learned something.
And I want to show you something else. And look, I'm not looking to make your life complicated. I'm trying to do diligence to, like, you understand your mouth more than you did when you came in here. And whatever you want to do about it will be up to you based on what I recommend. But if you look down below, down here, do you see a dark area?
Yeah, like that spot, like right.
Yeah.
Okay.
That's an infection. Now, why doesn't that hurt? I don't know. It just doesn't. But it's an infection. So if he came in today, which a lot of people do, and they say, I need a clearance doc, that's why I'm here, because I'm getting a knee procedure done, or my hip, I would say there's no way I'm clearing you. Yet it doesn't hurt him, but that's an infection. So, and it's a tooth, by the way, that's worthy
I choose. Like
of doing something about.
Yeah, it's
He also, I don't think, has a crown on it, so let me talk about that for a minute. When you have a molar tooth, a posterior tooth, and you get a root canal, anytime you get a root canal, you take the blood supply out of that tooth, and the tooth becomes brittle. So there's a lot of patients with stories about they went through a root canal, and that's not worth it, and the crown broke off, and the tooth broke off because they didn't crown it, okay? So that's what's going on there. Then you obviously know you don't have teeth there. Now we're going through your lower.
Did you feel like he needs to have teeth there? Like, should we?
I'm going to talk about that in a minute. So your lower fronts are, other than the spaces, probably have always had that, right?
It's,
Yeah,
it's,
getting,
spreading.
I mean, over, years.
I'll talk about that in a minute too. Keep going. So there's this other root canal.
Okay.
That's his right side. By the way, there's no infection here, and there's no crown here. And then, watch this. You see that back there? Way in the back? He's got a tooth root rotted in the back right of him, where his wisdom is. Again, no symptoms or pain. Now, I'm going to tell you something, 'cause I like to step back and say, well, what do I make of your mouth? I haven't looked in your mouth yet, of course. I can't see his gums and stuff. This really isn't a terrible mouth. What have I said? What's the worst thing? Like, if you said to me, what's the worst thing going on with me right now? You are missing a bunch of teeth. So I like to extrapolate that with a patient to, like, well, what does that mean? Well, if you had a truck, you have a truck?
No, I got a car.
Well, if you had a truck that had like 6 tires on it, or I used to drive a 7-Up truck for when I was in college. If you had that one of those with like 8 wheels, if you lose a couple wheels, I mean, and it doesn't take a doctor to say that it probably doesn't drive as well, and it probably wears the others. You don't die because you don't replace teeth. It's not going to be the end of his mouth. I want to make that clear. Okay? And you're walking around at 45, and these teeth have been out for a long time. Here's what I would tell you my approach is going to be with you. Okay? I'm going to sit you back on a look and say, what does John absolutely have to have in my brain if he wants to move forward and have a healthier mouth? What would I do? And I always look at your gum health first, because this is what I do know about your gums. Whatever I like or don't like, it hasn't affected your bone very much, which is a good thing for us. You don't know that, but it's a big common problem with patients. They get gum disease, gum inflammation, and then the gum leads to the bone being compromised too. He doesn't have the bone thing. So it means we're ahead of the game, that's what I'm saying to you. Second thing I want to look at is, what about, obviously I'm going to look at these teeth. This one's got to go. We already know that. That's a given. You can see that infection very well in this now on your left. See it?
Yeah.
See how you don't have that here?
Yeah.
So I'm going to tell you what I'm going to tell you to do with that tooth. And by the way, it's one of your last molars on that side, of course. I'm going to recommend you have it retreated by what's called an endodontist. I do almost everything here, and I take pride in that. But I don't do procedures that a guy can do faster and better than me. Because I don't care about the business aspect of this. I care about your time, the health aspect of it. Is fear any part of your thing? Be honest.
I'm not a fan of dentists, like, nothing personal or anything, but it is what it is.
A lot of, I mean, this practice is, we sedate, orally sedate with pills 60% of the patients we work on, and we don't even charge you.
Right.
So it's pretty sweet. If you need big things, that's the only reason I asked you that. So, let me take a look at you. Which prison do you work in?
Bayside, I've worked at all of them.
Yep.
He's worked all of them.
How much longer do you have?
7 months.
7 months?
Yeah,
At 45?
yeah,
Then what are you gonna do?
who knows?
That's a good question. I've been trying to get him to tell me where we're moving, and he can't seem to pick a place.
Were you moving or what?
We're moving. We're getting out of here.
Are you?
Yeah, I actually am an online blogger. I used to make good money blogging as
Okay.
a mom, so the social media aspect of you, I got you. But I am ready to get out of New Jersey because
Tennessee.
We looked there and it snowed and I'm like, nah, I'm not going to snow.
Well, when you moving?
October 1st.
Oh God. I got 9 months.
We got some time.
All right. Well, I have patients from other states, including Tennessee.
Well, we'll come back.
So if I'm good enough, you'll stay with me.
Yeah.
Let me just see what you feel like to me. Do you smoke?
Mm.
He's quads. I'll explain everything I say to you in English. Okay? When I'm done. I already told you that 32's out, right?
Yes.
32's got to go.
Yep.
So 18 is the one that needs to be retreated. 18,
Yep.
and then it will need a crown.
Okay.
And let me feel this a little bit. Yeah, damn. 31 needs a crown. 30 is out. It's missing.
Mm-hmm.
Just telling you that. Some things I didn't see. Yeah, so he has a DL to do on distal of 8. I'll explain again to you guys what I'm saying. ML on the, excuse me, a DL on the distal of 9. DL on the distal of 10. Okay, and just for the records, he's missing 19, 20, and 21. No, 19 and 20.
Mm-hmm.
He's missing 30.
Mm-hmm. And then I have 1, 5, and 13 also missing.
Yeah, I guess it depends on what he does. I'm going to talk to him about it. 5. 13 is too compromised to space, so he can't really do anything about that.
Okay.
If you could do something on the lower left, that would help, but I don't know if he has enough bone. He might. So make it clear, I'm telling you, on 29, I don't think he's got enough bone there. He does on 5. Okay. So this is really, you're an interesting patient for what I do. And I'm gonna tell you what I mean when I say that. Because remember I said the whole thing about dentists is,
Is it interesting good or interesting bad?
oh no, it's good, it's good. For you it's good, you'd be surprised because it's interesting because, like, I call it what to do when. What to do when. Like you're sitting here, you just met me, and I'm about to tell you what I would do. And it has implications on your wallet, your time, the direction of your oral health.
So I got dentures for the top, but they just,
You mean partials?
partial, I'm sorry, yeah.
Yeah.
And they just, I don't know, I talked funny with them and I never felt like I got used to.
So you're actually proving what I'm saying right now. Like somebody in their brain saw John and said, Hey, he's missing 2 teeth. Let's make him a partial. You know, well, what are you, 40 at the time or whatever age you were?
Yeah.
I mean, that's a hard ask to tell somebody at 40 something with posterior missing teeth to wear something that comes in and out, which is really not great for your teeth. Like sometimes we have to make them as dentist because maybe you're missing a bunch of front teeth and you don't have the financial wherewithal to invest in implants. You know, there's reason, and you're older or whatever.
So I think the reason why you got the partials was because I was doing a lot of public events, and that one tooth, when he smiled, you could see it really bad. So it was kind of for my career that you got the partials, right? Like you never really wanted them.
Yeah.
But he,
Nice.
like he's never really worn them. I think he wore them for like 2 brand trips to Disney and
Yeah.
Hershey, and that was it.
Not a little surprising that he didn't wear them.
Yeah.
They're not comfortable. And what I really just said to you is the patient's got to be really motivated to want to have that thing that they're taking in and out. So let me tell you how I see you. I'm going to sum it up. I see you a lot more now that I've seen this and I looked in your mouth. So what are some of the things that I'm concerned about? You need a really good gum cleanup. If I was a weight loss clinic, you'd be 100 pounds overweight, which you're not. I mean, I need to really get your gums revitalized, and that's because you just haven't had the appropriate cleaning. When I say cleaning, I'm not talking about like food all over your mouth. I'm talking about the health of the gums, and that's a big, big thing for me. And when you move wherever you're moving to, make sure it's a big thing wherever you go, because gum health is the gateway to a lot of other health with you, and the opposite. You have inflamed gums, it leads to a bunch of things, diabetes, all kinds of things that doesn't lead to diabetes, it exacerbates a lot of problems patients have. It's just something you want to be good, just like you want your weight to be within reason. So it's easy. We clean you thoroughly. I mean, much more than you've ever been. Okay? And patients don't get that. It's a big thing with me. And it's why a lot of my patients that I met a lot of patients at your age that are now 85 and 90, and most of them still have their teeth, because that's the gum thing. It's just a really thorough, we call it scaling root planing. It doesn't matter what you call it. It's a deep cleaning, and hopefully will shift the way he takes care of himself. That's that, okay? Then we'll drop back and say, okay, what about like cavities? He has a couple cavities, believe it or not, in his front teeth. Not big deal. We're gonna do them. It's gonna be part of my recommendation. Why would it not be? They're not like little spots, but they're not a big deal. And he would have to look in like a makeup mirror to really see them, but I can show you if you want. They're in the front.
Okay, it's fine.
Okay.
I trust you.
The big things on him are the next couple things. Okay. So he needs a crown on the lower right tooth that had a root canal before it breaks and we don't have it anymore. Okay? And he needs the tooth behind it out. Not a big deal. I do all that.
I hate that he has to go another tooth gone.
It's a wisdom tooth and he doesn't,
Okay.
it's rotted.
You know, I almost wonder, I don't want to blame his parents, but like, I almost wonder if he's used to pain in his mouth. Because I feel like he's always...
You guys have been married 25 years?
Almost.
Wow, you got a good one there, man. She's an advocate for you. I'm just saying.
I
That's
just
my
want,
good.
like, how can you go through... my mouth is so sensitive, and I look at him and I'm like, why
Here's the
is this
truth.
hurting you?
Here's the truth. Look at this tooth. It's rotted, right?
It's gone.
The nerves are rotted years ago.
Okay.
Why didn't it hurt him at some point? I don't know. Why does it hurt now? I totally get it. You know, it's just the way the oral cavity and pathology and symptoms associated with it work. And gums almost never hurt people. It's too bad that they don't, by the way. It'd be better if they did hurt, because
Yeah.
everybody have healthier
No.
gums.
Yeah.
His lower left, you could do a number of things here. I mean, if you want to keep that tooth, you got to have it retreated. Okay?
What does retreated mean?
He'll go to a root canal guy. The guy will remove the white stuff you see inside that tooth,
Okay.
and he'll do it faster and appropriately.
And
So
that's an endo...
that's root canal, right? Endodontics. And so I want you to understand how that happens. There's roots and tunnels in every tooth, and you can't get them pretty good. You got to do them really thoroughly. You got to do them under certain protocols, because the patient infection will not go away if you don't do it the way I just said, and that needs to be done there. And I'm just being honest with you. If you waited till wherever you moved to have that, that's fine. but let's talk about the next thing, the thing we keep alluding to. What about his missing teeth? Okay, and he does have spacing and all, and I gotta be honest with you. If it wouldn't be wrong, and he's probably not gonna do this, it wouldn't be wrong to have orthodontics first, brace. And I know, you don't have to do it, I'm just telling you, and close up his lower front space. Certainly wouldn't be wrong to do that. If that's a no-no on him, that he's just not gonna do it, then you proceed without it. It's gotta be an up to him thing. He's not 16, you
Right.
can't make him do it,
Nope, you can't make him do anything.
I can kinda get that. So,
We're just happy we made it into this chair.
so here's what I wanna say about his missing teeth.
Okay.
Ironically, I know he has space. When you go to put an implant in, you have to have enough available bone. And when you pull a tooth, on some people the bone goes away quickly, over years, sometimes. And sometimes it doesn't. So on his upper right, if you look at it, you're not even a dentist, you can tell that an implant probably would work here a lot better than it would on his left side, because he's lost space on the left. See it? So I would never put an implant on his left side, because unless he has braces and orthodontics and we move and create space, it's a waste of time.
I think at one point you had a slipper put on, right?
A flipper, yeah.
A slipper, like
A flipper.
A flipper.
Yeah.
Okay, I thought it was like
Slipper.
yeah,
Flipper.
whatever flipper. That was for another brand trip too, but it only stayed on for like 2 days.
Here's the thing with him. Here's something you don't know I'm about to say. So I told you I give courses, and I give courses in this office, because implant dentistry can be really expensive and blow a lot of people out the door.
Yeah.
So if you went to get an implant, like I told you he needs a crown down here, right? Well, when you do a crown, you pay for just the crown that goes over the tooth. When you have an implant, you pay for the implant and the crown that goes over the implant. Two different things. And if you went and priced out, the two of you, implants, you would find them, the least you'll find them is maybe $1,800, and the most you'll find them is $2,500 or $3,000.
And that's not covered, right?
No.
On insurance.
Just for the screw, not even for the tooth.
Okay.
So I give courses. In my courses, the screw is $600. Like, I'm not discount Johnny. That's not why people come to me.
Okay.
I want to make that clear. But in my courses, which are doctors, they're not students, they're doctors, and it's heavily monitored all over the place. I mean, we have dentists mentoring the 2 dentists doing it, plus me floating. So it's not like it's recklessly done. It's never that way. I don't know whether John has enough bone on his lower left, so how would I know? If you're interested, and it's an up to you thing, I can do what's called a read, R-E-A-D. So I take this and I put it in software and I see, does he have enough bone on his lower left, because that's his weak link, and his upper right, which I know he does on his upper right. And so you might have 1, 2, 3 implants, because I know he doesn't have room here, and I know, I'm saying bone,
I hear
and,
you.
or room.
Do you understand everything?
On the upper left, even if you had the bone, which you don't, it's stupid to put an implant. Why would you put one there? It's a skinny little space. You've lost the space.
I don't even notice it on that side. It's the
Yeah.
other side.
Yeah,
that's
because
most-
so you can have one on the upper right. I already know that. The question would be, can I have some on the lower left? Which would be wonderful if you could. Okay.
I feel like his digestion, so he had a gastric sleeve.
Mhm.
So I feel like him chewing food is super important, and I'm worried.
She's killing me. I need one of her. in my
We're here all
life.
day. If you keep,
I just-
keep
I just need
going.
him to live as long as possible. So
Yeah,
like,
zap and clone you and like have you as a confidant of mine. So here's what we're gonna do. Here's what the treatment's gonna be. So what happens when you come to me? I didn't know what you needed when I walked in this room. So what I'm gonna be recommending is this. This scaling root planing, clean you up really big. Obviously a couple cavities I mentioned. It's like 3, I think. The crown in the lower right, extraction of that tooth. This one is the first move on this. I'm not going to include it in my treatment because you got to go somewhere else to have it redone. You can go, where'd you say you're from again?
Cape Bay
Yeah,
or
keep
Woodland.
moving on.
I mean, there's a really good guy in Violin that does these like under an hour. His name's Dr. Wang. So give them a card for that. There could be somebody in Cape May that does it. You need a specialist though, not a regular guy.
Yeah.
And if you want me to do the read, you're not obligated, but don't tell me to read it if you're not interested, because they do charge me to read it.
Okay.
To read means I'll see if he has a bone for the lower lower left, excuse me, down here. And up here, I told you, I know you have bone already.
Okay.
So you could, in a course, you could have, what my hope would be is 3 implants. 1 there, 2 down here.
And he would be like a teaching model, like he would.
Well, he's one of, like, I have 35 patients that come in that weekend.
Okay.
We sedate you, we give you a couple hours, we numb you. It's all done what's called guided. So guided's an amazing thing, like all other surgeries today. It's not the way it used to be. So we make a guide that fits only on his mouth. It snaps on his teeth. It's got 2 keys, holes where to put the drill to do the implant.
Okay.
I could almost teach you to do it. Okay? I
You want
said,
me in your
Let's not get that far.
all right, I'm getting a little carried away. It makes it very predictable, is what I'm trying to say to you. Okay?
Okay.
So here's what we're going to do first. She's going to take that to Michelle. She's going to come back in, run that by you. Well, run by the treatment I know you need to have done.
Yeah, let's get his gums clean.
Okay? But my course is in May, by the way. So I kind of need to know whether you're going in that direction. Do you want that? And if you don't, I don't care. I mean, it's...
Is there any, do you guys work with Care Card or anything
Yeah,
like
care
that?
credit. Yeah,
Okay.
yeah. Okay, so you got all that?
Yes,
The other thing I
wanna-
did not include, and to my colleagues, if you're watching this, it's very important to tell you what you don't include. Because I've just said a lot. I don't expect these guys have audio perfectly memories. I told them about the root canal on the left, it needs to be retreated. You know, we're not including that because I need you could have that done technically when you move. And I would love it if we get my stuff done and we come dial back to that and get it done before you go, because I'll have complete control. You know, but he's asymptomatic down there, right? Doesn't hurt. But you will lose that tooth or you will have a problem eventually. I don't know when. Could be years from now, could be a year from now.
I just want to ask you if this
Yeah,
is showing up on AI. But
yeah,
I
let
don't
me
know
look.
about
She's
currently.
pointing out something on AI for me. On the tooth behind it, I guess.
Yeah, 17.
It's another wisdom tooth. Wouldn't surprise me. I don't want to overlook it. Correctamundo.
All right, so what did we want
That's
for that
out.
one?
Yeah.
Oh, extraction.
Oh yeah.
Okay.
Yeah. So that's a wisdom tooth. And why would I tell you? I know you just said to me I don't want to lose teeth. He would need a crown on this tooth. He might need a root canal on this tooth. That would be a bad expenditure of your. It's a wisdom tooth. You probably don't have yours. I don't have mine.
You helped me, right?
Yeah.
It would be much more productive. Go ahead. It would be much more productive for him to have used money for a root canal and a crown on a wisdom tooth. Someday on his mouth on orthodontics or.
I just don't want him drinking smoothies all day long. You know, like he just doesn't have.
Yeah, I get it. And look, it are very few wisdom teeth in my 45 years career that I told the patient to have a root canal and a crown.
Okay.
It's an outlier. You just don't do that, especially in a guy that needs other stuff.
Okay.
You know, so like the other stuff is like let's say I don't know if he has the bone down in the lower left, like I said, but if you don't have bone, you can grow bone. You know, so he may want to go in that direction one day, and it's pretty safe advice to you not to put a lot of money on a wisdom tooth.
Okay.
Okay, so you're gonna wait for Michelle, and then
We're at least gonna start with the gum cleaning, right?
Is the infection something to be, like, do I need to take an antibiotic for it or anything?
so when you said to me that the other doctor said to you that I can't help you or whatever, I'm not sure what she was referring to.
I think your mouth has gotten better since you said that. You've done really good. You're getting
The
better.
potential for infections on you right now, if I was taking an examination, I said, where's this guy infected? I mean, your gums are generalized, but I wouldn't call that an infection. I mean, that's kind of a harsh, I mean, they're inflamed,
Right.
for sure. The lower right tooth could have, the one I told you that's blown out,
Yeah.
that could have been an infection a year ago, whenever he went, for sure. The lower left, your wife's going,
It's way longer than a year.
Get
Your lower,
stitched on, it's fine, it's fine.
your lower left tooth, or any one of your wisdom teeth. Excuse me, the lower left wisdom tooth, or I was going to say the root canal on the left could have been. I don't know. There's not an acute infection. There's not an acute infection on him right now. You definitely need to commit, not just to your gums. You need to get rid of these. I call this put out the fires case. Like the fires are, a cavity is a fire. It's not a raging fire. This wisdom tooth's kind of raging. I kind of want to get
You
rid of
don't
it,
feel it?
right? The left one is going to be raging. So just, when I'm done with him, if he didn't even replace any teeth, he would have healthy gums, no cavities, and other than the one root canal that I showed you on that has a chronic infection that's been there a while. Other than that, he would be reasonably healthy. He would be missing teeth and all the same things he has now. You know, one more thing you do that I did not tell you about, which is an issue with him, and there's not that much you can do about it. He has what's called parafunction, so he's got a lot of wear on his teeth.
He grinds at night.
That's my point. So anytime you grind your teeth, it can't be a productive thing for your teeth. So I grind. A lot of people grind and they don't know that they grind. I mean, if he would wear a night guard, that would be splendid because you'll reduce the chances of you breaking teeth. It's probably how you lost the teeth you have. It's my guess.
Like, I will not be able to sleep, and I can hear him grinding, and I'm like,
I'm going to recommend a night guard, to be honest with you. A night guard's a small thing.
I have one.
Don't buy one on Amazon. It looks like a football mouth guard. It's not the same thing. Wait for Michelle. I'll be back.
All right.
Thank you.
Yeah.